You know what's weird? Despite eating dairy and taking calcium supplements, fractures and osteoporosis rates continue to rise, especially in older women. What if the calcium advice we've been following for decades is actually hurting us? Today, I'm exposing the 3 common myths surrounding calcium and showing how to actually build strong bones without putting your kidneys and your heart at risk. Plus, I'll share my favorite way to stop osteoporosis at the end. So that way you don't end up like a grandma with bird bones in the shape of a question mark. I'm Dr. Forrestauer, and for the past 12 years, I've helped postmenopausal women stabilize their bone health without endless pills or confusion. Because in functional medicine, osteoporosis is not just about calcium intake. You've probably been told by your doctor to take some calcium. But is that the truth? For most Americans, this advice only works in fantasy land. If you're inflamed, it doesn't matter if your calcium was carefully curated by angel cows on a cloud. It's not getting into your bones. Here's what most people don't realize. Chronic inflammation stops your ability to absorb and use calcium. Nearly 60% of Americans are walking around with low-grade inflammation and don't even know it. Inflammation messes with everything in the body, not just prevent calcium absorption, but create fatigue, destroy your gut lining, and mess with your hormones. So you can take all the calcium you want, but if your body is inflamed, you're not absorbing it, and your body's certainly not using it to strengthen your bones. In fact, that calcium just floats around, building up in your arteries or your kidneys, not your skeleton. So before you double down on your calcium, ask yourself, is my body even ready to use it? If not, fix the inflammation first. It's the reason why so many people take calcium and still end up with osteoporosis. Now for the second myth about calcium. Most people think that dairy equals calcium, but this often doesn't work for 2 reasons. Milk decreases your stomach acid, not only making it challenging for your stomach to absorb the calcium that's in the milk, but makes it challenging to absorb all the other foods that you eat. And in many women, dairy creates inflammation without them realizing it, further blocking the calcium absorption. It's like expecting a plant to grow in toxic soil. It doesn't matter how much you water it, it's not going to grow. Instead of dairy, eat these high calcium foods that have low inflammation. Sardines with the bones. Yes, it actually tastes good. And yes, I was extremely skeptical in the beginning. Collard greens and bok choy go great on any salad or add them to any dish for an additional veggie boost. These 3 foods can provide you with the calcium your body can actually absorb without the dairy drama. And for myth number 3, many women think that they need to take calcium supplementation because more calcium equals stronger bones. But studies show that calcium just floats around in your blood vessels, collecting in your kidneys, creating kidney stones, and leaching onto your blood vessel walls, making them hard and brittle. It's like dumping broken glass down your drain. It's going to eventually clog, crack, and break down. Bones are living tissue. You need the right environment to allow the calcium settle where it's needed. Plus, your calcium will not be absorbed without magnesium, vitamin D, and vitamin K2. The body needs vitamin D and magnesium to absorb that calcium, otherwise it flows straight to your toilet. And in a recent study, 64% of women are lower than 20 nanograms per milliliter in vitamin D, which is extremely low, and they didn't even realize it. Which means that 6 out of 10 women have calcium pass right through them. All the while, they think that the calcium they are taking is helping. The body needs vitamin K2 to get into the bones. It's the key that unlocks the bone door for calcium. And in another study, a staggering 97% of women are low in vitamin K2, which means that only 3 out of 100 women get the calcium into the bone, which is the whole reason why you started taking calcium in the first place. Now, at this point, you might be thinking, I need to go buy a calcium supplement that has vitamin D, K2, and magnesium. However, remember, this only works if you fix the inflammation first. But here's the biggest trick to building strong bones so you don't end up like a grandma in the shape of a question mark with bird bones. It's called Wolff's Law. Here's what no one is telling you about your bones. Your bones are active living structures, not passive beings like bricks in a wall. They're alive and they respond to the stress that you put on them. That's what Wolff's Law is all about. It says your bones adapt and grow stronger when you put more load under them. In other words, your skeleton literally rebuilds itself based on how you use it. So what's the trick? You have to put stress on your bones to make them stronger. Not like stress, like arguing with your kids or paying the bills. I'm talking about mechanical stress, like resistance training, weightlifting, or even carrying groceries in from the car. Think about your bones like muscles. Use them and they will grow. You can take calcium, magnesium, vitamin K2, and vitamin D. You can absolutely do that. But if you're not putting load or working your bones, it's like drinking a protein shake and sitting on the couch. Your muscles aren't going to get bigger. Wolff's Law changes everything. It tells your bones to adapt or die. Your strong bones stay and your weak bone cells go away. And you can get stronger bones at any age. You just need to give them the right stimulus. And that stimulus is movement that makes your bones work. That's why we always tell our clients, strong bones don't come in bottles. So how often should you do resistance training? About 2 to 3 times a week is the sweet spot. You don't have to live in the gym, but consistent, regular targeted exercises are going to help build those strong, healthy bones, like lifting weights, resistance exercises, load bearing exercises. Those 2 to 3 sessions a week is enough to tell your bones, hey, you're still in the game. Don't give up yet. The key isn't perfection. It is consistent effort over time. Creating healthy bones is about decreasing inflammation, absorbing and using the calcium that you are taking, and putting stress on those bones. If you found this helpful, hit the like and subscribe button. It really does help out this channel. And if you want to watch more videos regarding your health, click on one of the videos on your screen.